Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MD-TV. Welcome to Super Mama Sunday, where we have been talking about taking back your birth, reclaiming your power over your pregnancy, your labor, your birth, and your postpartum period. So today I want to talk a little bit about pain control options. That's a biggie. A lot of people really worry about what's going to happen when they go into labor. What are going to be their pain control options? What's the pain in labor going to be like? So I want to really hit up this topic today, and we'll spend a little bit of time talking about that. So make sure you keep watching. All right, Super Mamas. So let's talk about this whole pain in labor thing, right? People really get very anxious about what pain in labor is going to be like, and I think that it's a little bit different for every birthing person. And for some people, it's very intense. For others, it's not so intense. Like some people will tell you, oh, I was 5 or 6 centimeters and I didn't even know I was contracting. So that's one side of the coin. Other people are 2 centimeters and they think they're about to die. So it's very different. And, I really think that has a lot to do with how many nerve endings are right there at the cervix. And I noticed this because when I go to do, like, say, a cervical check or a cervical exam, some women are very, very sensitive to those, and other women are not at all. And it doesn't really matter if it's their first baby or their 10th baby. If they're very sensitive to those cervical exams, they seem to tend to have more painful labors, in my experience. And that's completely anecdotal, meaning I don't have any scientific evidence to back that up. I haven't even really looked into the literature on that, but I have noticed that just in my experience. So anyway, when it comes to pain in labor, as the uterus contracts and starts to thin the cervix out and cause the cervix to dilate, then you do start to have what are called labor pains or contractions. And those can be, can feel different in different women. As you hit the 3rd trimester, many women start to experience what are called Braxton Hicks contractions. And these are more like practice contractions, so to speak. So they're like tightening in the belly, but they're usually not super painful. Some women do experience pain with Braxton Hicks, but they're just kind of like tightenings, or like maybe like some light menstrual cramps or like menstrual cramps, but not super, uber painful. They're usually pretty tolerable for most women. Well, real labor contractions can be quite painful. And usually you know that you're in labor because you start to have regular, very painful contractions that are getting closer together and that are getting more intense in terms of the pain. So we really want to start to think about, what are we going to do with those contractions? And if you are someone who is aspiring to have an unmedicated birth, meaning that you're not using any pain medicine by mouth or by IV or via an epidural catheter, then you want to start thinking about this early on, like during your pregnancy. There are lots of different methods for pain control in the unmedicated birth space. So these would be things like hypnobirthing. I'm gonna link some videos down in the description box about hypnobirthing so that you can kind of get some ideas. But this is where we really start to train our minds to help us through painful contractions. So we start to focus and be mindful about things that are in the room. I've had folks use things like an object on the wall, a stress ball in their hands, breathing techniques or exercises, mantras that they're repeating. So they're using a specific focal point, either a physical focal point, a focal point in their mind, a sound, a word. So they're focusing on something to help them through that painful contraction. There are breathing techniques like Lamaze that are also very helpful. Movement can be very helpful during contractions. So things like walking, dancing, sitting on the birthing ball, shifting your hips from side to side. I love this belly dancing routine that is done by a person I met on social media. She actually teaches belly dancing for labor. So I'm going to link her information in the description box down below. And I just think it's wonderful because it's a great movement of the hips, and it's a great way to open the pelvis to allow the baby to come down into the birth canal. Water is also a great way to help relieve pain. And so if you are birthing at a birthing center or a hospital that has a tub for water birthing, that might be a great way to relieve pain if you're starting to have really intense, painful contractions. If you don't have a tub available to you at your birthing facility, you might want to think about hot shower. Allow hot water to run on your back or on your belly. That can be a great pain reliever. If you want to use warm compresses like heating pads, those can be helpful as well. Binding is another thing that I've used in the past. Like we'll use a hospital sheet, a hospital bed sheet, actually to wrap around the lower parts of the hips during contractions to kind of help relieve that feeling that the hips are about to break apart. And that can be really helpful for mamas, especially if they're having a lot of back labor, but it can be helpful for moms who are having normal lower abdominal pain with their contractions too as well. So these are things. Massage is another great technique as well, doing some low back massage, belly massage, really just supporting mom with physical nearness and touch can be helpful, and sometimes not, because I have had moms that are like, just don't touch me, so that can be helpful. Music and focusing in on outside sounds, mantras and meditation can also be something that you can use for pain control in labor, and really kind of finding that space inside yourself that you can go to and kind of retreat from pain. The important thing to remember is that pain is relative, and it's also something that comes from our body to our mind. And so we have receptors in our brain that tell us that we're in pain. And so by training your mind to deal with those pain receptors, you're able to kind of really train your mind not to start this cycle of fear and anxiety and tension in your body, because tension, fear, and anxiety seem to actually trigger more pain receptors in your brain, and it heightens your pain. So whenever you're afraid, whenever you're tense, whenever you're anxious, your brain perceives more pain. In addition, the more anxiety and tension that you're holding in your body, the harder it is for the baby to get down into the birth canal. I can't tell you how many times I've had a mama who is trying to have an unmedicated birth, and she is so tense. She's got her legs squeezed together. She's gripping the arm rails on the bed, and she's not really making very much change in terms of her cervix dilating. The baby's not really moving down into the birth canal, and then she'll get an epidural, and then she relaxes, and suddenly she's 10 centimeters dilated and the baby's coming out, almost coming out on its own, because she actually relaxed. And so what I encourage moms who want an unmedicated birth to do is to really start focusing in on relaxing their pelvic floor muscles, doing some meditation work, and learning how to relax those pelvic floor muscles during contractions, and simulating that even before they start to have really painful contractions, because that relaxation of the pelvic floor allows the baby to get down into the pelvis. So practicing movement, sitting on the birthing ball, really working on how to voluntarily relax those pelvic floor muscles, so that when the time comes, even though you may be having a contraction, how to just actually focus your mind on relaxing those pelvic floor muscles and being able to do so even when you're not in a comfortable position when that contraction is hitting. So let's say unmedicated birth is not for you. That's not how you're trying to do this. So there are a couple of different options for medication. There are oral medications, which we sometimes give. Generally, oral medications, though, have a longer time to onset, meaning it takes them longer to work. And so we usually use IV medication for laboring people. And we may use things like fentanyl, we may use Stadol, we may use Nubane, some folks use Demerol. And those are usually pretty quick acting, they work pretty fast. They take the edge off of labor, but they don't really take the pain completely away. They may make you doze in between contractions or make you really, really sleepy, but when the contraction hits, you still know it's a contraction for the most part. The other thing is that these medications do cross the placenta and they do get to the baby. And so most hospital policies that I know of they don't really want us to give these sorts of medications after you get to about 8 centimeters. The problem is that once you hit 8 centimeters, this is usually the phase called transition. This is when you are really getting into active labor and the baby is coming down into the birth canal. And this is the most painful stage of labor for most women. So it's like, okay, now I'm hitting the time when I really, really want something, and we can't really give the IV pain medicine because it is a narcotic pain medicine and it crosses the placenta and it makes baby really sleepy. And because baby's really sleepy, the baby doesn't want to wake up and take those first really important breaths to open up the lungs and to start the circulation going in the way that it needs to go after birth. Because of the limitations of IV pain meds, I recommend to my moms that if they're at the point where they feel like they really, really need pain relief, that they consider just getting an epidural. And an epidural is where a tiny catheter is actually placed in the spinal column into the epidural space. And the epidural space is a space that contains the nerve endings that go to the lower half of your body. So the epidural catheter is placed there using a needle. And so the needle goes into the epidural space and it drops the catheter off. And that catheter is used to drip medicine into that epidural space so that the nerve endings are bathed in this numbing medicine so that you're numb from just below your breast down to your feet. A good epidural allows you to still be able to move your legs and to move your bottom, but you don't feel pain, you just feel pressure. So people get so wigged out about these epidurals, like, oh my God, I'm gonna be paralyzed. The risk of being paralyzed by an epidural is actually very, very, very low. Now there are some risks to epidurals, and if you are in a birthing facility that provides epidurals, then your anesthesia team will talk to you about those risks. But one of the biggest risks is what's called a spinal headache. And that's where some of the fluid in the spinal column leaks out, or you get a small bleed and you have a headache after your epidural is taken out. And those can be treated relatively easily. The other more common thing that happens though is that sometimes people get bruising around the tiny muscles that are around the spinal column. And so they may feel a little tenderness in that area. They don't feel it when the epidural is going in because before the epidural is placed, the anesthesia team will numb that area with some numbing medicine before they put that needle in your back. So you feel like a little bee sting in that area, and then you don't really feel anything when they go in with that longer needle to drop the catheter off in the epidural space. So a lot of people are absolutely terrified of the epidural, but most people say that the IV that you get in your vein is actually worse than getting the epidural. So if that's something that's on your list of things that you're really anxious about or worried about, you can probably cross that off. For the most part, the IV catheter in your arm is going to be worse than the IV catheter or the epidural catheter in your back. Now, of course, I'm going to get comments on this video like, oh no, my epidural was much, much worse. So it definitely is case dependent, but for the vast majority of folks I see, they say, oh gosh, the IV in my arm was worse than the epidural catheter in my back. I barely felt that at all. So, it's definitely case dependent. It's dependent on who's putting it in, of course. And then, of course, the person who's receiving the epidural. So if you have spinal column abnormalities, or if it's very difficult to find your epidural space because it's such a tiny space and everything's done just by feel, you can't see it at all. So maybe your case was a little different, but for the most part, the majority of patients are not going to have a real, hard time getting an epidural placed. But if you're really getting to the point where you are requiring a lot of IV pain medicine, it's probably best to go ahead and get an epidural. Now, the epidural has numbing medicine that is going into that space and bathing those nerves to keep you numb. You want to talk to your anesthesia care team about, what exactly is going into that epidural. Some folks put narcotic medications in through the epidural, and some places don't. So if you are concerned about the medications that are going in your epidural, talk to your anesthesia team. There may be some options, and you can always discuss those, and you can discuss risks and benefits and alternatives. That's always something that you have the right to do as the patient, and you can know what's going in, and you can discuss that, and you can ask questions, and you can ask for alternatives as well. So nowadays, lots of folks birth with epidurals, but there are groups of people who want to have unmedicated births where they don't want to have any IV pain medicine, they don't want to have epidurals, and that's totally fine. And I think really how you manage your pain during your birth is your business. But what I always advise folks to do is to make up your mind about it. Don't let other people tell you what you need to do or how you need to manage your pain. If you go in saying, I want an unmedicated birth, and then you get to a point in your labor where you're like, oh no, this ain't it, and you decide that you want to have an epidural, then get one. Don't let anybody make you feel guilty about that. If you need to reevaluate your original plan and make a different decision, then do that. Don't allow anyone to guilt you or to make you feel like you failed at something because you need to reevaluate and make a different choice. It's your body, it's your birth, it's your baby, and you should be the one who's making the decisions, who is asking the questions, and who is deciding on what needs to happen in that space. So don't let people play you like, oh man, you punked out, you got an epidural. No, certainly don't do that. And also don't let people push you into getting an epidural if that's not what you want to happen. So make sure that you are the one who is making the decisions about your body and your process. I also encourage moms to speak up if their pain is not well controlled. Unfortunately, we know that sometimes people's pain is dismissed, and that's not something that should be happening. There are occasions where, say you got an epidural and it's not working well, and it may need to be redosed, where they add another big dose to the epidural to get you more comfortable, or it may even need to be replaced. Sometimes some people have a little bit different structure in their back, and the epidural is not able to reach all of the nerve endings, and so they may have one little spot that hurts really bad, and that's like a hot spot, and they may not be able to get that hot spot numb. So even after replacing the epidural, I've sometimes had mamas who have that one hot spot, and I always say, if we've replaced it, we've dosed it, and that one spot just can't, the medicine's not reaching that one spot. I always say, think about if your whole belly felt that way, like that one spot, and that spot is just really tender. And so we try to do what we can in terms of repositioning and seeing if we can get the medicine to that spot, but sometimes we just can't reach that spot, which, is so unfortunate, but we always do everything we possibly can to make you comfortable. But definitely continue to voice that, hey, this spot is not really controlled. And sometimes there are options that we can do, like locally in those, by injecting those hot spots. But sometimes it's out of our hands. Like, we may not be able to fix everything, but continue to talk about where things hurt and what's going on, and just make sure that you are being heard and that we're kind of responding to that. If you feel that something's wrong, like your pain has suddenly dramatically increased, that something may be going on, voice that, and make sure that you receive feedback about that. So whenever you voice that, hey, something just happened, something is wrong, my pain just exponentially increased, there needs to be some sort of feedback and some sort of intervention. So just continue to be vocal about that and confirm that you were heard. I just mentioned that my pain really increased. Did you hear me? And that's totally okay to do. So at the end of the day, is labor and birth a painful process? I would say for most people it is. And the one thing that I always say is that in life, there are some processes that are painful. And if we decide to go through life and try to avoid everything that's painful, think of all the things that we would miss, right? I don't think that we should intentionally put ourselves through pain, but I think that there are some things that are completely worth it. And I really encourage moms to think about how they want to manage their pain and to go in knowing that these contractions are every contraction is gonna bring them closer to their goal, which is to have that baby in their arms. And whether they decide to manage their pain in an unmedicated way, or if they decide to use an IV pain medication or an epidural, it just needs to be what they want for their pain management. And every time that they endure something, it's bringing them closer to that goal of meeting that baby. So I think that it's so important for us to set our minds on and set our sights on the ultimate goal, and to decide early how we want to manage the process so that it doesn't become some sort of horribly traumatic process. If you decide to go unmedicated and it is turning into a traumatic process, if you are like grabbing the bed rails and shaking them and you're screaming and you're, and it's just becoming more traumatic than it is a beautiful, meaningful experience, then you may want to consider some pain control with a medication or with an epidural. Make the process what it needs to be for you, I guess is what I'm saying. I hope this video was helpful for you, and if so, give it a thumbs up. Let me know in the comments what you plan to do for pain control, or what you did during your birth when you birthed for pain control. Make sure you subscribe so you don't miss a single Super Mama Sunday episode, and I'll catch you next week, Super Mamas. Peace.